We are so incredibly excited to welcome Dr. Ellie Danaher. Ellie, how are you?
I'm good, thank you. Thanks for having me.
So much for being here. I'm really excited to talk all things sleep today. I was just explaining off air that I feel like it's a very talked about topic in our household at the moment. And believe it or not, most of the time our baby is the best sleeper. It's the other ones who are going through weird sleeping regressions. I feel like one starts getting nightmares. The other one just likes to wake up in the middle of the night and shout my name. It's all fun. It's all fun and games.
Yeah, absolutely.
Anyway, before we get into the stuff today, can you start by telling everybody yourself?
Yeah, so I'm Dr. Ellie. I'm a consultant paediatrician at Mediclinic. I run clinics at Parkview Hospital and also at Dubai Hills Mall as well, which is a relatively new clinic. Yeah, very nice, a very nice atmosphere there. And I see all children from the day they're born, I suppose, up to the age of 16. So I get to see lots of different conditions, lots of parental concerns, and I guess a lot of babies and toddlers, yes, with sleep problems, and parents who come into me with, lots of questions around sleep and around feeding and what they're doing and how they can better get their children into routines, and hopefully I can help them with that.
Yes, I love this. And we are going to come on to sleep, but before we get on to that, obviously you've mentioned to me that you're a mother of 3.
Yes, that's right.
How was sleep in your household when they were small?
Well, okay, so they were all different.
Don't they, all these kids?
Yeah, you kind of think once you've done it once, it's just a case of copy and paste, and then, you can do it for all the other children. But yeah, so I have 3 children. They're all kind of grown up now. I've got 2 teenage boys and a daughter who's 10 years old.
Sweet.
So I guess, yeah, they were all different sleepers. My first child was definitely more of a feisty one. Very difficult to settle. Had that classic kind of crying in the witching hour, difficult to settle later on in the evening when I was a bit overtired. So
yes,
I definitely had that challenge with him. And certainly nothing at medical school, nothing at my paediatric training quite prepared me, dealing with these things. So I definitely had to learn on the job on how to settle him and get him down to sleep. And thankfully, when he was asleep, he was generally pretty good. My second child had his own challenges. He was a refluxy baby. Yeah, so he fed beautifully, but then he would just vomit and he would get extremely uncomfortable after feed. So again, really difficult, really challenging time. And for anyone listening who has a baby who might have reflux or is very uncomfortable after their feeds and they're finding it difficult to sleep, this is certainly something that we can talk about and help manage. But thankfully, after some different techniques that we used, and actually he needed some medication to help him, he settled nicely. He still vomited, and that settled them.
Yes.
But the comfort in sleeping got a bit better. And then my third was probably somewhere in between. My second was actually quite a good sleeper, but my third one, she was somewhere in between, quite relaxed. But the problems I had with her was more that she'd be waking up quite consistently throughout the night until she was about 3 years old. Yeah. So I've lived through it all. And I feel like, certainly having that real life experience and having your own children and living through it does give me, I suppose, it can help my patients as well, and can help other mothers. Yeah. Knowing that I've got that real life experience, I can empathise.
That's what I do.
And I can help with some practical tips and things like that. Yeah, like I say, it's not something that we cover much at medical school. But I think most medical schools have very little, if no, training about sleep, which I think probably needs to be addressed with the last few decades. We're learning so much more about sleep and the health benefits of it. Yeah. Conversely, if you're not getting enough sleep, how detrimental it is to our emotional, mental, physical health. So it's so important. We learn about this and we help each other out.
I agree. And I mean, I've had two very refluxy babies. The small one now, it was more silent reflux. And my first one was, once I figured out he had a cow milk protein allergy, once I figured that out, he was quite straightforward. He went onto the hydrolyzed milk, actually did base milk. And it was like day and night. Overnight, he started sleeping. And before that, he was okay at night normally because he was so exhausted from the day because he just cat out. Yeah. And it was difficult to settle in the day. Night, stretch because he was a big boy and he was very good at feeding. But then from like 3 a.m., be squirmy, uncomfortable, wriggling, kicking. You just hear the thud, the legs on the bed, and I was like, oh God, here we go. So there's so many things that affect sleep, and also when these babies are so small and they've, the organs are figuring out how to work properly and how to digest food properly. I mean, I just feel like stomach issues in small babies is
common concern. Yeah, see a lot of parents in my clinic, and that is definitely a hot topic.
Yeah,
something we talk about a lot.
So in terms of like the most common sleep issues people come to you with, what do you see a lot of? Is it refluxy, colicky issues, or are there?
So I suppose yes. I mean, colic is a big one.
Yeah. It's very mixed views on if this is a real thing. Is basically a word used to describe a bigger problem like reflux.
Yeah, well, it can be. It can be. And trying to unpick it with parents, obviously we need to know if there's something else more serious underlying. We do have a definition for colic. It is supposedly 3 hours of crying per day for 3 days of the week and for 3 weeks. So that's the sort of general sort of definition of what colic is. And I think we're quite quick to diagnose babies as having colic if they come into clinic and, or parents have already diagnosed it and then say, my baby has colic, they're sort of crying a lot. And there can be a number of reasons, obviously, why the baby is crying. And it's our jobs to really examine the baby, talk a lot about their feeding, look at their growth, making sure that they're thriving, and try and understand if there's maybe something else, such as reflux or such as an allergy, or just that they're just a different, temperament. So all of these things can play into it. Obviously, we do try and sort of give general advice about sort of colic. There's limited evidence that any of the medicines that we give actually helps as probiotics. We do use, which there's some evidence that can help with colic and promoting a good sort of. But yeah, and some of these other products as well, we can give them a try. Yeah, just help. It might help parents to feel that they're somehow is in some control. Of it as well. But anything we can do, we'll try and work through it. It doesn't last forever. No. So usually it starts at around 2 to 3 weeks of age, and then by around 3 months you should be starting to see an improvement.
I colic, or the colicky symptoms, let's call it, or other underlying issues, essentially their body's figuring out.
Yes, I mean their gut has never absorbed milk, they've never created any gas and wind, and that's just normal.
I agree.
So a lot of it can be very normal, just baby behaviour. Yeah. And it's kind of reassuring once we've examined and we've excluded anything else, just reassure parents that unfortunately this is part of it. Yeah. These are some techniques and things we might try to help improve things, and then it's not going to last there.
Yeah. I think I remember someone saying this to me, and it's probably one of the best pieces of advice about parenthood I've ever got, is everything is a phase. Move on to the next one. It might be less challenging, it might be more challenging, it might be completely different. It's all a phase and nothing lasts forever. Another thing I've actually, I feel like I've done a lot of research into sleep and colic and reflux and everything else. Yeah. Again, from a medical standpoint, I don't know if this is legitimate or not, but a lot of people say that babies, depending on how they arrive into the world, can hold on to some trauma. And we've always taken our kids and a baby chiropractor. Yeah. Both have they solved the problem? No. But the osteopath this time round, I went to see an osteopath with Rocco probably every 2 weeks. until he was about 5 months old. And that was probably the only thing, and switching his milk, that has calmed him down and made him more of a relaxed, happy baby.
Yeah.
Those moments I was blown away. And you've got lots of Mediclinic now, haven't you, as well?
Yeah, so we have physiotherapists that can certainly help. And yeah, I do talk to parents about sort of complementary therapies as well, as some people do find them very useful. I'm always clear to talk to parents and about complementary rather than alternative. Yes, so I think it's important to do these things in collaboration because yeah, there could be an underlying medical problem, so it's important to seek advice from your paediatrician or your family medical doctor from that point of view. But absolutely, I know a lot of parents who find chiropractors and osteopaths very useful. And yeah, I'll certainly refer on to them for some complementary therapy.
I think always check the medical first, and then if there's anything else that could help, get it on as a add-on support. I want to talk about bad sleepers, because we often as parents get asked a lot about sleep. I feel like within your friendship circle, if you've got friends who've got small kids, there is that sleep, passive baby sleeping. We are very quick to label our kids as bad sleepers. In your opinion, do you think kids are born the way they're born, and that is just how they get sleep or not sleep? Or do we as parents create an environment that makes our kids good sleepers or bad sleepers?
Yeah.
Or both?
It's a really good question.
What's to say on this point as well?
I mean, calling a baby a bad sleeper is so negative. And we're trying not to be negative about it. But yeah, then the whole nature-nurture debate is, there's definitely a lot of talk around that. And we know for sure that babies are born with a particular temperament. You know, there are a lot of factors involved in sort of what makes your baby who they are. And a lot of that will be sort of based on their just genetic makeup and who they are inherently. But I think there's definitely things that we can do that help nurture that, you know, that personality. And there are different personality types. I think you can go into detail and try and categorize them all. But broadly speaking, there are the children that are more feisty, the ones that are a bit more difficult to settle. They're kind of wired. Their neurological systems are such that they're just kind of into everything and alert, and we just find it really difficult to wind down their brain and get ready to transition into kind of that sort of sleepy mode and getting ready for sleep. And there's certainly things and techniques that we can put in place and the parents can put in place to try and help them to do that. And then on the flip side, yes, there are children who are just inherently completely relaxed, and you'll be looking at them 1 minute and they'll be one. Turn you back and then look back and they'll be fast asleep. And I'm like, how did that happen? So I think, children are definitely born with a personality. But what we do and how we help them with that particular personality will definitely shape how they sleep. So there's certainly techniques that we can use.
Yeah, for sure. And actually on that point, as a first-time mum, I think obviously becoming a mum for the first time is overwhelming, and you are so hyper-focused on this little being. Yeah. And I know that when I was a first-time mum, I did it all. My attention was purely on him. You know, I'd rock him to sleep. I would, when in the pram, I created these habits, these cues. Yeah, he then got used to when it came to sleep. And I remember at one, I would have him, so I would stand over the crib, fucking crazy. And one day, I to stop. And had I understood that I was creating these bad habits for him, maybe I would have thought twice about them. But you don't as a first-time mum. And it's not until second time round you realise, low maintenance, you're so continuous, because essentially you're so focused on your other child, the toddler normally, or the young child, that the baby just gets put down in the cot. See you later. And that's one of the biggest things that I've I would say now to parents is try and, I think cuddling your baby when they're babies is so important. And I would never say don't give your baby all the cuddles and love. It's not going to spoil them. It's not going to make them a bad sleeper. But I think as they grow a bit older, don't get into the habit of rocking or barking to sleep.
We talk about it in terms of dependent sleep associations.
Yeah.
You might have heard about it. And ideally, we want to get to a point where we are developing independent sleep associations. So we want to encourage our little ones to, they do need, they will get to a point where they're tired. You'll be able to read their cues.
Yes.
But perhaps not straight away as soon after they're born, but you'll get to understand their cues and sort of their different cries, their movements, and trying to respond to those. So sort of looking for their arm movements, you'll see them sort of, their movements becoming a lot more jerky when they're getting tired. And certain cries that they might be making, you're like, right, okay, they're getting tired. And then we can respond to that. And suddenly they need cuddles. They need that touch.
Yes.
And they need help settling. I mean, if you think about how we go to sleep as well, and try and think about it in terms of what we do, we start getting sleepy. We don't just kind of pillow and fall straight asleep. It just doesn't happen that way. We need a bit of time to kind of wind down, and we might sort of toss and turn a bit in bed and sort of soothe ourselves a bit in that way to kind of drift off to sleep. And babies need the same, so they'll need that touch, they'll need that reassurance that you're there. Don't know what to do then. And sometimes how these bad habits sort of creep in is sort of rocking them to sleep into their deep sleep, or feeding them into a deep sleep, because that's what we would call a dependent association.
Yeah.
So they're learning, they're sort of trying to learn how to soothe and get themselves to sleep. And it's our jobs as well to try and help them to achieve that and develop some good independent sleep associations. So by all means, walk and sing, or even doing the like the sort of white noise and those kind of things to kind of replicate the sounds that they might have been hearing when they were in the womb. And that kind of helps to sort of calm them. But don't do it until they're deep. Do it until they're just about sort of settled. And then you want to try and transfer and put them down, so that when they do nod off into their deep sleep, they're not being rocked to sleep. They're actually already in their bassinet or the cot or wherever you want them to be. Because we all have sleep cycles, and a baby's sleep cycle is quite short.
Yes.
And you're talking about
the 30-minute count number.
30 minutes
Sleep cycle.
is a sleep cycle. So for some babies, it might be a bit longer. And actually, if you watch your baby, you'll probably be able to see them go through these different stages and start to learn and pick up on what their sleep stages are like. So you go into your light sleep, then you go into your deep sleep, and then you come up to your REM sleep, which is your dream sleep. We call it REM. It's rapid eye movements. You might even be able to see your baby's eyes moving around. And that's when they sort of, again, are coming out of that sleep cycle. And they might be awake after that for a short period of time. Now, if you've rocked them to sleep or fed them to sleep and they're waking up after that cycle, they're going, what's going on?
Yeah.
Why am I not being rocked? I want to go back to sleep. I'm not being rocked. I'm not being fed. And, these things aren't happening, which is kind of how I'm meant to be getting to sleep. And then they'll wake up. And it's very difficult then to sort of settle them down. You like put them, to feed again and get yourself into a little bit of a cycle with the sleep cycle. So, these things don't happen overnight. They take a bit of practice, and but hopefully sort of gently encouraging our baby to kind of have these independent sleep associations will certainly help them and help you get the rest.
Yes,
you need.
I agree. And I want to come on to sleep safety in a moment. But just to touch upon like sleep hygiene and routine, again, like all of our kids have had white noise. I know that some people have mixed opinions on white noise. It's been a game changer for us. White noise is that, it's sleep time.
Yeah.
Simply calms down. But safety, my youngest, which other kids were fit by, but he loves to cover his face with a muslin or soft, or he'll clutch something against his face until he falls asleep. And I'm like, this is awful. I mean, he's getting to an age now where he can move things off his face. Yeah. When he was young and he wanted to have something on his face, I would have to sit and watch and wait until he was asleep. And then, because terrified of him smothering himself. They like, I mean, certain things, cues, you know, they really help. Talking about comfort routine and having these kind of cues to help them get ready for sleep. Do you think routine is key for babies?
Absolutely. Yeah, absolutely. I mean, I think we all like routine when we think of ourselves. Then I suppose a few people don't like it. But if you think, I don't know, for us, let's say you're going on a trip and you're going to, or a work trip, or you're going abroad on a holiday. I mean, it's meant to be a relaxing time, but there are certain things that were sort of out of routine. Maybe it's a different time zone, be a different bed, be different food, different environment. And I think most of us would say our sleep is sometimes quite affected by these changes. Yeah. It's the same for babies. Well, I mean, they're just the same as us. You know, respond really well to a nice routine. You know, they will be communicating with you the way they know how, and they're crying and their movements, and we'll be responding to that and just helping them, you know, get into those nice routines. Yeah, like we spoke about, kind of recognizing when they're tired, knowing when it's time to kind of stop doing that big kind of bright musical activity, because that's just not what's needed now. We need to kind of maybe dim the lights, we need to quieten everything down, and we need to help them get sort of, you know, their brain into gear, ready to take that sleep. And, you know, they're responding to our cues as well from that. Just helping to settle them and then get them back down to sleep and get that much needed sleep that they need.
Exactly. That's the thing. I was going to come on to that, the importance of sleep. And I mean, we've just got back from France, and we talked about kids. And obviously I have two older kids who don't nap anymore. The poor baby just has to follow suit and nap on the go during away, because, you know, no one's going to go and sit for 2.5 hours with other kids in tow. So we did so well, but it really, really just showed how important the daytime nap is, as well as the nighttime sleep. As the day went on, you know, he was only having short naps here and there. He was definitely not getting enough sleep during the day. And when we got to nighttime, he was so much harder to put down because he was so overtired. Yeah. I think all sleep is important for us. Establishing good daytime routine where he's getting the bigger chunks of sleep has also just made life so much easier. And I think also as parents, we need the routine as well. I mean, personally don't function very well not knowing when I'm going to have a moment to get on top of what I need to get on top of. The uncertainty makes me spiral. In terms of that stage, and I know the baby stage is quite a big stage, but let's say and 6 months, how much on average should our babies be getting across the 24 hours?
So yeah, I think we can break these down into different stages. So between 0 and 3 months is kind of the first stage, and during that time our babies will be getting, well, when they're initially born, they just sleep. First few days, I sleep all the time. It's a question that I always get, my baby sleeping too much. So just enjoy it whilst it lasts. It won't last. It won't last forever. And we have guidelines, but not every baby fits the mold. But about 14 to 17 hours a day is what is normal, and that's quite a big difference actually. And it can be outside those ranges anyway. And that's between sort of 0 and 3 months, and then between 4 months and 12 months, it's a bit less than that. Yeah. But in the first few weeks, there's no real night day.
No.
Babies, you might have heard, I mean, lots of people probably know about this circadian rhythm. Babies just don't don't have that.
No.
And they probably don't develop that until around sort of 3 months, actually.
Mm.
And that's a question I do get a lot in my clinic, is that my baby's got their night and day confused. Well, they don't really, because they don't know the difference between night and day, and they shouldn't at that stage, because the routine at that stage should be
More relaxed.
be relaxed and just responding, and kind of, if they're up and they're crying, they're probably need feeding or changing. Then they'll have a tiny bit of awake time where they might be sort of awake and sort of looking around before they're getting tired again, and then they're going back down to sleep again. And that's just generally kind of, try and keep it simple, sort of feed, awake, sleep. And feed, awake, sleep. That kind of is the routine for the first few weeks.
Yeah.
If not for the first 3 months.
Yeah.
Around that time.
I agree with that.
And that's for a very good reason, because they need frequent feeding, they need to maintain their blood sugar levels, they can't feed very much, I mean, so small, so they need those frequent feeds. So they're waking up because for a very good reason.
Yeah, exactly.
Because they biologically need to do it. Yeah. So we shouldn't really expect too much in those first few weeks, and it is exhausting.
But again, comes back to the phase.
Yeah. It's all a phase, and
Yeah.
it will get better, and they will naturally get better as they get older. And then sort of beyond that, then you might be starting to see a bit more of a routine coming into place. They'll be having more awake periods where they're interacting more, they're now smiling, they're sort of interacting more with you. And you might be understanding more of their cues, because they'll be communicating with some of their cues, their facial expressions and the noises that they're making. And so you'll start to learn a bit more about them then, and they'll start to understand the difference between sort of day and night.
I want to talk about sleep safety next.
Yeah.
So medically, what is medically safe? I mean, obviously there was a stage in life where cot death was massive. And I think, again, becoming a parent and just hearing the word cot death, it just sends shivers down your spine. And I know a lot of the cot death back in the day, correct me if I'm wrong, because I could be wrong, was down to what mattresses were being made out of. But there are lots of other things that we need to be very aware of that can contribute to cot death. So can we talk through those?
Absolutely. And I think it's probably the most important thing when we talk about sleep in babies and toddlers, is keeping them safe. And so there has been a lot of research into SIDS. I mean, it means the same thing, but SIDS refers to sudden infant death syndrome, and it is a parent's absolute worst nightmare. And anything that we can do to prevent that or reduce the risk of that happening, obviously we're going to do, but we need to educate, and parents need to understand, and they need to know what is it that they can do, that they're in control of, that they can do to reduce the risk of any of these horrible events happening. Now, there will be things that a baby is born with that does put them at increased risk that we don't have control of, such as if they've been born prematurely or if they're small for gestational age. So we'll be super vigilant in those babies. But there are steps that we can take. Now, the first one is back to sleep. So that has reduced the risk of SIDS drastically. So it's important that when we're putting our babies down and settling them down to sleep in their cots, that they are going down on their back. And that is not on their side, and that is not on their front, definitely not on their front. But lots of parents will ask, oh, well, I can put them on their side. Absolutely not. They should be going flat on their back to sleep. And I think there are good reasons for this. Babies are born with very big heads relative to their bodies, and very small airway. They have big tongues. The idea is we want them in a nice neutral position so that their airway stays open. And also we need them to have good temperature control. And if they're put prone, they can't control their temperature as well, and they may overheat. So if we put them on their back, we maintain their airways nicely, and we can sort of manage their temperature as well. So back to sleep is the first one. Mattresses, yes, is the second one. So you need a firm mattress with no loose sheets. It should be new as well. So no, we don't really say second-hand mattresses yet. Get a new mattress, and for each baby as well.
That was my next question, because I've had the same mattress for 5 years now.
theoretically, we should be using a different mattress for each baby.
Yourself? We'll be doing that.
So nice and firm one. I think there's there's so many products on the market these days. They're marketed to us as these kind of wonder products that will help your baby sleep, but not all of them are safe.
No.
So always check the safety standards and make sure that you're using a product that has been, and I can tell you where to find it. So yes, firm, flat mattress, not raised, nothing, just so flat. And then the third thing is no cushions, no soft toys, no bumpers, so nothing else in the cot. Okay.
So bumpers and all these kind of things. Cot bumpers are really terrifying. I have horror stories about cot bumpers. They never have one in my cot. When it comes to and soft toys, now my little boy is now 6 months. Is there an age where they are more acceptable, or?
So I think most of this guidance is up to 12 months. So ideally not.
Gosh.
See, they sort of the younger they are, I mean, they will learn to roll, and they'll start rolling maybe from 8, 12 weeks, or they'll be moving around more and they'll have better head control at that stage. So sort of that positioning, once they start rolling is I suppose almost a bit less important.
Yeah.
But we still advocate for sort of lying them flat.
Yes.
And not having anything else in the cot, because the risk is that they will roll, they may sort of inadvertently get caught in something, obstruct their airways. Yeah, ideally. So that's the soft toys and cushions. The other thing is cushions. Yes. So lots of parents want to put one of these special cushions so their baby's head doesn't get flat, because they get a lot of fuss about that as babies have been put on their backs. Yes. A lot of them are getting quite flat heads and what we call plagioccephaly. And there's a lot of products on the market saying this will prevent it because it's a nice pillow that's kind of shaped in a nice round shape to keep the baby. They are not safe. So you can use them during the day. That's no problem if you're watching. But at night time, no, because they could tilt their head in a different way, obstruct their airway. Again, they could roll on it, get stuck, suffocate. Yeah, we don't advocate for having any cushions in the bed there. Temperature? Yeah. That's another big question we get asked. What temperature should it be? Usually, it should be between 20 and 22 degrees. Now, that's actually quite cold when you've got the AC on. So I would go for the 22 here. I think actually if you're in the UK, it's even colder because you have central heating. So you kind of actually, the room temperature should be cooler than that. Babies have really immature systems, cardiovascular systems, and they can't really regulate their body temperature very well. So it's up to us to be able to do that. And overheating is horrific.
Never buy a radiator.
Yeah. And the other thing is clothing.
Yeah.
So what should we put up, what clothing, and wrapping them up in loads of blankets? Absolutely not. As a general rule, maybe one extra layer than you're needing, but they don't need that much clothing. Their hands and feet may feel cold to you, but that's, their little noses, and their extremities. That's okay, as long as their core temperature, they will divert blood to where they need it, which is their organs, brain, and everything like that. So as long as their core temperature feels okay, it's okay if their little hands and toes are a little bit cold. That's no problem.
And one thing that it was actually my husband who told me this, which was like, paying attention. They will tell you if they're cold. Yeah. They will shout.
Yeah.
It's extremely unlikely that something bad from your baby be too cold before they tell you. Whereas if it goes the way, being overheated makes more sense than likely to tell you when they're overheated.
Yeah.
I think, anyway.
Yeah.
Could be wrong.
Yeah.
The way we've always played it is it's better for them to be slightly cold and tell you about it than overheat and just happen.
Yeah. And no hats. Don't sleep in a hat. This is how babies regulate their voice. They might lose their heat through their heads. They might even sweat a little bit because they're kind of releasing their heat from their heads. So no hats. So I'm a big fan
I love swaddling. Yeah, I loved the swaddling.
It's safe to do it, and it can be really actually helpful in settling your baby, but there's an age and a stage to do it.
Agreed.
So, and that is generally whilst they've got the Moro reflex. Now, the Moro reflex is that startle reflex that babies have. It's they're born with it.
Yep.
You might notice it when there's a loud noise or they move too quickly, they suddenly put their arms out in this kind of startle reflex. And that's very normal, but it disappears around 8 weeks. So sometimes swaddling can be really helpful because babies are tired and they get frantic. Their limbs kind of jerk and move around and they can startle themselves awake. So swaddling them just replicates kind of their comfort that they've had, and they've been in that environment in the room in very small space, so they're kind of used to being squished in this way. It's comforting for them, so it can be really helpful to settle. So yes, swaddling is safe to do as long as you do it with something light, so not a heavy blanket, not something that's going to make the baby overheat. A muslin or a thin cotton sheet, something like that. And really just aiming to swaddle the arms, not to wrap too tight that kind of constricts their breathing or their hips or anything like that. But it's really those arms that we want to keep in.
Yeah.
And can be really useful. But as soon as your baby starts rolling, moving around, or that startle reflex is sort of dampened down and it doesn't exist anymore because it does go away, they should be unswaddled and shouldn't be swaddled, because it would be a risk then for them to roll over and not have their hands out and able to sort of move themselves around. So yes, swaddling is okay.
Love swaddling. The other on sleep safety now, I'd love to know your thoughts on this. We've had a baby monitor, again the same one that we've used for all 3 kids, and again I think it depends on what type of parent you are, but I'm quite anxious parent, and I've always really struggled with the whole sleep thing. Constantly wake up wanting to check on the baby, and we've got a camera called the Nanit camera, and they put a breathing band around the babies, and then we actually have sleep sacks that have a built-in breathing band, so there's again nothing is loose in a cot. So when he's on the monitor, I can see him breathing. See he's breathing, how slowly he's breathing. And I mean, the comfort that I get from that, really or wrongly, I don't know, but I am obsessed with it. And things like, obviously, when babies are getting a fever or maybe they're getting unwell, their breath speeds up. Again, if I roll over in the middle of the night, he's breathing at 50, 55 breaths a minute, then I'm like, oh, something might be wrong. I can go and check on him. But it's very fascinating also to see how their breath changes. So that is, again, if you're an anxious parent like me, have you heard of the Nanos?
I haven't. I don't know. Have a look. When my daughter was born, they had one called an Angel.
Yes,
your baby.
The sensor. I've heard of those as well.
So I think the jury's out on these products.
Yes.
It can add to our anxiety.
Agreed.
And they're certainly not necessary. If I think it depends what sort of person you are, and if it's definitely going to give you that kind of reassurance and make you sleep better, then yes, I would say as long as you know what to do if that alarm goes off.
Yes. Yeah. Agreed.
And so many times I hear parents will come in because the alarm's gone off, and the baby's been absolutely fine. And it's all a false alarm. There's big alarms going off in the middle of the night, and the baby's fine. Yeah, rush into hospital. Babies, like you say, in their sleep stages, they will go through in their deep sleep, their breathing becomes very shallow. A lot of these products won't pick it up. And then babies be absolutely fine. But yeah, some of the products just won't pick it up, and that alarm and cause a lot of tension and anxiety for babies, absolutely. So I would say I'm sure there's probably information about these products on some of the websites about safe sleep. So just to direct people to one of the websites, it's called the Lullaby.
Yes.
which is a UK-based charity to help to reduce the risk of SIDS. And it's got loads of excellent resources on there. Reduce the risk of SIDS for your babies. I haven't covered all the topics, but there are a number of other things: smoke-free, breastfeeding, all these kind of things, which all help to reduce the risk of SIDS. It also has some really helpful tips there about products.
Great.
What products are safe, what products are not safe, what we should and shouldn't be doing. Can be really, really confusing. You want what's best for your baby, you know, everyone does. Yeah. And then, you'll think that buying this product is what's best. And just have a little look. Have a look on the Lullaby Trust before you go ahead and spend an absolute fortune in those products. And just make sure that they are safe. So above all else, safe ones.
Dr. Ellie, before we round up today, I wanted to ask about getting extra support. As we said, the first couple of months can be full of sleep deprivation. And sleep deprivation is a form of torture. It's the worst. I've been there. It's not enjoyable. For parents that you see that come in to see you are struggling, and you said them, where can other people get additional support for parental mental health within the Mediclinic network?
So, mum burnout, the lack of sleep. We all know how this affects our emotional and mental health. And it does, increase our anxiety levels, risk of depression, and all of these things. And this is so common. And I think the first thing to say is that, to ask for help.
Yes,
absolutely. That's the first step, because so many people will just suffer in silence and think that they're doing a bad job, feel super guilty for not enjoying it, perhaps, and feeling that there's something actually wrong with them. And I just want to reassure them that this is so common. And all those people out there saying that they're absolutely fine and it's all a breeze, this is just is not likely to be true. Everyone has had their own struggles and challenges along the way, and it's okay to kind of put your hand up and say, I'm struggling, I need some help. So coming in and asking for it is definitely the first step, and asking your partner and your sort of friend network and everything like that is, getting that support from people sort of close to you is really, really important, because you might really be able to help, and asking them for help first as well. Yeah, talking to a family medicine doctor. We would refer you to family medicine, and there's a whole team of other people that if we've got concerns about your emotional or mental health. There's certainly people that we would be able to refer you on to. But sometimes it's just a simple thing is sort of sharing a problem. And sort of a problem shared is a problem halved, right?
Yeah, for sure.
And getting that extra support, that you need. Yeah, it's not that you're failing; it's just you need a bit of extra help.
I agree. And do you know what? Someone once said to me that you would never go through life not servicing your. But we don't. It's not common practice to service our brains. Essentially, that is what. Especially this phase of motherhood, with everything else that comes with modern motherhood now, I just think it should be common practice for people to have that outlet to speak about what's worrying them. Because again, you could offload on a friend or a husband or something else, and I think for small things, that really helps. But having a neutral person who can support is so freeing. And I think, the most important thing is never suffer in silence. If something doesn't feel right, definitely get it checked out, because, gosh, hormones can do awful. And the lack of sleep is actually. And there's so much you can do to support yourself during those phases. Before we say goodbye today, where can people find you if they want to come and say hi?
Okay. I'd love to see anyone who wants to calm down their babies and have a chat about, anything really. But I am at Parkview Hospital, or I'm at Dubai Hills.
Love this. Guys, put this in the show notes, but Dr. Ellie, you've been absolutely phenomenal. Thank you so much for your time. We have loved speaking to you. And hopefully we'll continue again soon.
Yes, thank you.
Thank you.